Hello, everybody. This is Catholic Dad, episode number 167, Moral Hazard and Why Do We Have a Drug Problem in America? When I say moral hazard, I don't mean like morality in the Roman Catholic term. I mean in the insurance term. We have a bad insurance agency, we have bad insurance mandates, and this is kind of making all sorts of market forces that are in the wrong direction. So what is insurance first off? Insurance is something that you purchase that's called shared risk, meaning you have to purchase it, that protects against an uncommon or rare event. So if you buy fire insurance for your house, in the unlikely event that your house burns down, you will be covered by all the other people that bought the same fire insurance, okay? And if you live in a fire zone, your insurance premium should be higher. Much like car insurance, if you insure against, say, collision. Now, that's what insurance is. You actually have to purchase it in shared risk with other people. That's the true definition of insurance. Now, for something to remain insurance, by the way, it can have something called moral hazard. Moral hazard means that by purchasing the policy, that the event becomes more likely. If the event becomes more likely, it has an attribute called moral hazard in the insurance logoi, and if it has the moral hazard, then it can no longer be called insurance. For example, if you buy fire insurance for your house is no more likely to burn down by purchasing the actual insurance policy. If you buy car insurance, you're not more likely to get in a car accident. Therefore, these are true, genuine insurance policies. The problem is we have something called insurance mandates, number one, and we also have something called free insurance, which you can't have free insurance because it's shared risk. And this creates all sorts of market distortions in America, and this also creates a drug problem amongst a lot of people in our nation at the hands of the insurance agencies and the government working in context with one another. Let me explain some more. I was on call one night in my intern year, and back then I was working maybe 110 to 120 hours a week. I was on every third night. I'd barely get to sleep when I was working. I got a phone call at, say, 3:30 in the morning one night when I got to sleep. Rarely ever got to sleep, so I was not very happy about getting a phone call. But nonetheless, I'm like, hello, it's blah, 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 it's Dr. Catholic Dad. And then the guy says to me, well, my child has a fever, and I'm like, oh, okay, how long has the child had the fever? I go through the whole thing, put the phone to his mouth, I want to hear him breathing, have you given him anything for the fever? He's a little wheezy. Do you guys smoke? Yeah, we smoke 2 packs a day, Well, don't smoke around the baby anymore, or around the child anymore, because that makes the child wheezy. It's not good for his health. And so, okay, we'll do that. He said, well, what do we do about the fever? And I said, a little bit of Motrin or Tylenol. And so he said, well, please write me a prescription for that. I'll come to St. Joe's and pick it up. And I said, no, what are you talking about? He said, well, whenever I call, they write a prescription. I pick it up at the front desk. And I said, no, I'm not going to do that. Why would I write you a prescription for Tylenol or Motrin? And he said, because, it's covered by insurance. And I'm like, I was kind of groggy-headed and tired. And I said, well, why don't you quit smoking for a day and pay for your own Tylenol, but not really, I didn't say that. But, well, he said, why did I get this dang health insurance if it's not going to pay for Tylenol or Motrin? And I said, sir, what kind of insurance do you have? And he said, I have Medicaid. And I said, well, you don't have insurance. And he said, well, they called it insurance. I said, well, it's not insurance. And he said, well, why not? And I said, well, for insurance to be insurance, it has something called shared risk. And he said, yes, so? And I said, well, how much did you pay for it? He said, it's free. And I said, right, it's not insurance. There's no shared risk on your part, meaning everybody else is paying for your benefits. That's called welfare. You have welfare, sir. He said, well, I want my prescription. I said, no, you're going to turn me in the morning and complain about me, but I'm not getting out of my bed to write you a prescription. Quit smoking for a day and pay for your own kid's medication. Well, anyway, so all that being said, so when you have that market force where you actually get something free within the market and it's paid for by other people, that's not insurance on 2 avenues. A, it doesn't have shared risk, and number 2, it has something called moral hazard. Now let's get to the drug problem in America. The federal government, it's all its worldly wisdom, decided to make the fifth vital sign pain somewhere around 15 years ago or something like that. And I remember being a little kid in medicine. I was growing up, a young doctor, thinking, this is the stupidest thing I ever heard. Everybody on the planet has pain. What are you going to treat everybody's pain? It's like once you get over the age of 40, everybody has some kind of ache or pain that they want treatment for. And what are you going to have? The federal government dole out all the money to all the people with pain? And you think about this now. So if you have subsidized, taxpayer subsidized insurance, which it's not insurance because it's not shared risk, then you distort the market forces. Then it has something called moral hazard, meaning that when people get this said insurance, they're more likely to use it than if they do not have said insurance because they're not paying for it. Now, if you create the fifth vital sign called pain, meaning every time somebody complains of pain, somebody doles out a pain pill to them, then they're more likely to use it and they're more likely to get it. Now, here's the funny part. When I was a young physician, I was a young attending physician. I got out of residency and I was trying to purchase my own health insurance. So I went to the insurance guy and I said, listen, I don't want any pain coverage. I have a wife with lots of kids. I was like, I don't even want obstetrical care. I'll pay out of my own pocket. I try to trim it down to all the basics like cancer and car accidents, like the real big stuff that is really expensive. I didn't want to pay for office visits. I didn't want insurance against office visits. And he said, well, you can't do that. And I said, well, why can't you do that? He said, because there's something called insurance mandates in the world. You have to have all the other coverage. So it's got me thinking, why do I have to have all this damn coverage? The coverage that I don't want in insurance because of insurance mandates. So now let's do some thinking about this for a second. So what is an insurance pool? It's a big blob of money that's put there by a whole bunch of people, right? So if you have insurance mandates, is this blob of money going to get bigger or smaller? It's going to get much bigger, meaning that the insurance companies, through force of law, are going to have more and more and more access to the people's money. Now, who creates all these insurance mandates? It's lobbyists, right? And so who has the biggest lobbyists on the planet? It's called Big Pharmaceutical, Merck and Bayer and all the other corporate entities. And so what do they do with these insurance mandates? They go to the federal government and force them to pay for pain. What do they do at the exact same time? They develop lots of pain pills that are highly addictive. And so now you have an insurance company called you have an insurance product with moral hazard in it, meaning people are more likely to use it, and insurance mandates forcing the public treasury to pay for all the big pharmaceuticals that these big pharmaceutical companies are ramming down everybody's throats that tend to be highly addicting. And therefore, I'll tell you what, this is like one of the biggest conspiracies on the planet, and I wish everybody recognized it because you have big corporations lobbying the public treasury, grabbing public taxpayer dollars to make people into drug addicts and become addicted to pain pills. That's a major problem. And that's why you should never have free health care because people are far more likely to use it. And that's whenever you have free health care, then the government has to ratchet back on it and start denying people health care because it becomes overblown and too expensive. That's because there's no market forces limiting people. Now, if you now this is something reasonable that everybody should think about. Let's just say people decided, hey, guess what? Insurance is no longer paying for simple benign pain. Cancer pain, yeah, I get it. Car accident pain, I get it. But I'm a 33-year-old man and my back hurts. Yeah, no, we're not paying for that anymore. And if you did that, then people would have to start paying for these pain pills out of their own pockets, which would then give them a market force and would decrease the moral hazard, and therefore they would less likely become drug addicts because the pain pills are no longer free and no longer paid by the public treasury. That's what the federal government should do. That's what Medicaid should do. That's what all insurance agencies should do. The problem with the insurance agencies is this. If you started making people pay for their own pain pills out of their own pocket, that pool of money that the insurance company uses to invest would get smaller and smaller and smaller. Therefore, it's working against the people that are insured. And so if we wanted true insurance, we should legalize insurance. We should be able to have people go to a private insurer and say, listen, I want insurance against cancer, car accidents, and other big catastrophes. I don't want to insure against hurting knees and low back pain. That's what I'll pay for that out of my own pocket, or I'll learn to suffer and deal with it. And so let's think about that, people. when you want to lobby for bigger and bigger and bigger government, it creates all sorts of economic distortions and all sorts of distorted economic signals that only drive up the usage of said product that the government creates. And if you want to bankrupt this nation even further, you're going to create universal Medicare for everybody because everybody's going to want to use it. Then when it bankrupts the nation, then suddenly everybody gets denied certain components of healthcare that they may want. What they'll say is, hey, you're 75 and you have pancreatic cancer. Sorry, goodbye. We're no longer going to treat it because we have to pay for pain pills for 23-year-olds or something like that. And so, well, anyway, this is Catholic Dad making you think about it. Study moral hazard. I think it's really, it's an interesting point. And if you like economics like I do, and you study moral hazard, you'll start understanding market forces and human behavior. And then maybe you can go make your own business. That's kind of cool. And study insurance too, because insurance is it's an important thing that you probably should have some of, but you don't want to over-insure yourself. So get as little insurance as you need to get by to protect against future catastrophe in your life. You should never insure to the maximum. You should always insure to the minimum, everybody. And that's another thing is the insurance agencies lobby for all these insurance mandates, so you have to pay for the maximum. And then big pharmaceutical gets on board and says, well, we want a piece too. And by the way, when big insurance agencies, big pharmaceutical, and the government get in bed together, what is that called? That's called the fusion of state and corporate powers, which a man called Benito Mussolini once called fascism. So, by the way, there's another thing, our medical system. The capitalistic medical system's too expensive. No, it's the fascist medical system's too expensive. If it were capitalistic, then we wouldn't have all these insurance mandates, and we wouldn't have necessarily free stuff, and then there would be market forces driving down the costs for everybody. So this is Catholic Dad making you think about it. Please like or subscribe, share with your friends, and please comment on this one. I mean, if I touched you a little economically, if you like that economic tickle that I gave you, I could do more economic videos in the future. God bless you. Take care. Share with your friends, and peace be with you. Get the Mass and pray the daily rosary.